Diabetes has one name, but it has two very different stories. Both increase sugar in the blood, but they start for different reasons. They affect people differently, and they are treated differently. If you mix them up, you misunderstand the disease. Today, we will clearly separate these two roads, so you truly understand diabetes. Let's start with one simple truth. Diabetes means sugar stays high in the blood, not for minutes, not for hours, but again and again, day after day. This hurts organs slowly. This harms blood vessels quietly. This is why diabetes is dangerous. Even when it feels normal, sugar gives energy, but sugar cannot enter cells alone. It needs insulin. Insulin works like a key. It opens the door of body cells. Only then can sugar go inside. No insulin, or weak insulin action, means sugar stays outside in the blood. Type 1 diabetes starts very early in life, sometimes in childhood, sometimes in teenage years. Here, the body cannot make insulin. Beta cells are damaged or destroyed. This is not caused by sugar-eating habits. This is not caused by lifestyle. This happens because the immune system mistakenly attacks the pancreas. The body loses its insulin factory. Without insulin, sugar cannot enter cells. Energy cannot be used. The body becomes weak. That is why type 1 patients must take insulin daily, not as a choice, but as survival. This insulin replaces what the body cannot make anymore. Type 2 diabetes is different. Here, insulin is present, but body cells stop listening. The key is there, but the lock is rusty. Sugar stays in the blood. The pancreas tries harder. It sends more insulin. Over time, the system becomes exhausted. Type 2 diabetes grows with modern life. Less movement, more sitting, more processed food, more sugar drinks, less sleep, less sunlight. This lifestyle trains the body to stop listening to insulin. Genes also matter. Some families carry higher risk. Some bodies resist insulin faster. This is not your fault alone, but awareness gives power. If diabetes runs in your family, your daily choices matter even more. Here is the simplest difference. Type 1, insulin is missing. Type 2, insulin is ignored. Both cause high blood sugar, but the cause is different. The treatment path is different. Understanding this difference prevents dangerous mistakes. When you know the difference, you protect yourself and others. You avoid wrong advice. You avoid dangerous myths. You support people correctly. In the next part, we will see how diabetes is tested and how early signs appear, long before major damage begins. Diabetes does not shout at first. It whispers. Many people feel normal for years, but inside the body, damage slowly starts. Blood vessels become stressed. Nerves get irritated. Organs work harder than they should. That is why testing matters. Not when pain starts, but before pain starts. One is done before eating. This shows your baseline sugar. The other is done after eating, usually 2 hours later. This shows how your body handles sugar. Together, these two tests tell a story, not just one number, but how your system responds to food. Normal sugar means your body is balancing well. Sugar rises after food, then slowly comes down. This rise and fall is healthy. It means insulin is working. It means cells are responding. It means energy is being used properly. Normal sugar is not zero sugar. It is balanced sugar. Prediabetes is not diabetes yet. It is a warning. Sugar is higher than normal, but not dangerously high yet. This stage is powerful because it can be reversed with movement, with food changes, with sleep, with daily habits. Prediabetes is your early alarm system. Prediabetes usually has no pain, no clear symptoms, no obvious signs. That is why people ignore it. They feel fine. They look fine. But inside, the system is struggling. Waiting does not help. Small changes now prevent big problems later. Daily sugar tests show today's level, but HbA1c shows your average sugar. Not for one day, but for many weeks. It tells how sugar behaved inside your blood cells over time. It is like a memory of sugar exposure. This test helps doctors see long-term control. One sugar test can lie. You might eat less one day. You might walk more one day. HbA1c cannot be fooled easily. It shows your real habits, your real patterns, your real risk. That is why doctors trust it. For long-term decisions, the body sends small signals. Feeling tired without reason, blurred vision sometimes, wounds healing slowly, frequent thirst, frequent urination. These are not random. They are gentle warnings. Listening early protects your future health. High sugar thickens blood flow. Nutrients reach wounds slowly. Oxygen reaches tissues slowly. Cells repair slower than normal. This is why small wounds become big problems in diabetes. Early sugar control protects healing power. Tests give clarity. Clarity gives control. Control gives freedom. You are not powerless. Your daily choices matter. In the next part, we will connect these tests to simple lifestyle actions that protect your health long-term. Diabetes shows itself slowly, not with loud pain, but with repeated small signs. Feeling thirsty again and again. Going to the bathroom many times. Feeling tired without heavy work. These are not random problems. This is the body asking for balance. The body is saying, sugar is staying too high inside me. When sugar rises in blood, the body tries to remove it. Kidneys push extra sugar into urine. Water follows sugar, so more urine is made. You lose more water. That creates thirst, so you drink more. Then you urinate more again. This cycle repeats. Sugar is energy, but energy must enter cells. Without insulin working properly, sugar stays in the blood. Cells remain hungry. The body feels weak. Muscles feel tired. The brain feels slow. Fatigue is not laziness. It is energy not reaching cells. Healing needs good blood flow. Healing needs oxygen. Healing needs nutrients. High sugar damages small blood vessels. Flow becomes slow. Repair becomes slow. So small cuts take longer to heal. Small infections become serious. This is why foot care is important. For people with diabetes, the eye lens is sensitive to sugar. High sugar changes fluid balance. The lens swells slightly. Focus becomes unclear. Vision blurs. This blur can come and go. It is not always permanent, but it is a warning sign. Long-term high sugar can damage eyesight. In some people, weight drops suddenly. The body cannot use sugar, so it burns fat. Then it burns muscle. Weight falls without dieting. This is common in type 1 diabetes. It is a danger sign. It means the body is starving. Even with sugar in blood, high sugar irritates nerves. Nerves carry messages in the body. When damaged, signals become weak. Tingling starts. Numbness starts. Pins and needles feeling appears. This is called nerve damage. Early sugar control protects your nerves. Sugar feeds microbes. High sugar weakens immune cells, so infections grow faster. Healing becomes slower. Skin infections repeat. Urinary infections repeat. Small wounds get infected easily. This is not bad luck. It is biology under stress. Symptoms are messages, not punishments. Early action changes outcomes. Movement helps insulin work better. Simple food helps sugar stabilize. Sunlight improves metabolism. Sleep repairs systems. Small daily habits protect big organs. Diabetes control is not one magic trick. It is daily small decisions. Think of it like 3 main levers: food, movement, sleep, and one free helper, sunlight. You don't need perfection. You need consistency. Food timing changes sugar patterns. Late-night heavy meals are a problem because you eat, then you sleep, and the body cannot use sugar well in sleep. A simpler rule helps. Try to keep dinner lighter and avoid very late eating. People ask, what should I eat? Use a simple plate rule. Half plate, vegetables. 1/4, protein. 1/4, carbs. This makes sugar rise slower and keeps you full longer. It is not a diet trend. It is balance. Not all sugar behaves the same. Sugary drinks hit fast. Packaged snacks hit fast. But whole foods move slower because fiber slows absorption. If you want a simple improvement, reduce liquid sugar first. That one change helps many people. Movement is a natural sugar controller. The easiest habit is a short walk, just 10 to 15 minutes, especially after meals. Your muscles use sugar as fuel, so blood sugar comes down naturally. No gym required, just daily walking. Walking is great, but muscle is also powerful. More muscle means more storage space for sugar, like adding more rooms to keep glucose safe. You can start simple. Squats, wall push-ups, light weights. 2 to 3 days a week is enough to begin. Sunlight is free medicine. You don't need long hours. Even 10 to 20 minutes helps. Daylight supports vitamin D and supports metabolism. It also improves mood, and better mood helps better habits. Simple and practical. Sleep is not lazy time. Sleep is repair time. When sleep is poor, stress hormones rise, and sugar rises with them. Late screens make sleep worse. A simple rule helps. Reduce screens before bed and keep sleep time consistent. Diabetes damage is often slow, like a small leak. One day it looks harmless, but months later, it becomes a big problem. That is why early control matters. Not for today only, but for eyes, kidneys, nerves, and heart. In the future, here is a simple weekly plan. Walk after meals most days. Build a balanced plate daily. Keep dinner earlier when possible. Add 2 strength days per week. Get daylight most days. Protect sleep like an appointment. And check your numbers as advised. Small steps. Repeated steps. That is prevention. This video is for education only. It does not replace medical advice. If you are worried about sugar, talk to a healthcare professional. Understanding your body is powerful. Small daily choices change your future. If this helped you learn something new, like the video so more people can find it. Subscribe to learn health in simple words. Share this with someone who needs it. Knowledge saves time. Early action saves health.